Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hi, everyone. Hi, Chicago. It is me again, Olusimbo Ige, the city's doctor. I am the commissioner, and today I have the unique pleasure of having with us Dr. Katelyn Jetelina. I am telling you, she is an exciting, interesting public health leader. I am so happy you took out time to join us today. I would like you to introduce yourself a little, but there are just some things that just stood out to me when I saw your bio. One, that you have more than 250,000 followers on your Substack profile. That is just amazing. And then named Time 100 most influential people in health. You know, at a time where people are just floundering and trying to find their space in public health and where to go for information, I think those are just two remarkable achievements. And so thank you very much for taking time to join us today. And we would just like to know, tell us about who you are, how did you get into the space? And how did you build this followership and become such a trusted voice in public health?
Yeah, well, thanks for having me. It has been an absolute wild ride. I still view myself as just an epidemiologist, trying to help people walk through the scientific discovery ride. And it all really started. Well, it started years ago. I worked at the WHO in Geneva, and then came back to the States to get my PhD in epidemiology. Started building a research lab at a University of Texas Health Science Center for a few years, and then COVID hit. And all of us were put on this all hands on deck response for COVID, and I jumped in. I not only helped lead responses in Texas, particularly Houston, but also started communicating to the general public. My dean asked me to give an update to staff, faculty, and students every day. And I signed those emails, "Love, you're the local epidemiologist," because that's who I was to them. A few days later, one of the students came to me and she's like, "Dr. Jetelina, can you just put this on Facebook so I don't have to keep copying and pasting my emails for my family and friends?" And so I remember talking to my husband, like, it's only going to take 6 weeks max. And then surely someone's going to pick up the baton and start explaining on a national level what was going on in plain language. And that didn't really happen. And so here we are 4.5 years later. And my newsletter is still growing like wildfire, even beyond the emergency. And because public health touches our lives on every day. Wherever you look, there's public health. And so, I mean, this week there's gun violence, there's from the Surgeon General, there is dengue is coming up from the South. We have the Supreme Court decision around emergency medicine for pregnant people. So it's everywhere you look. And so it's been fun to bring the public along for that ride.
Congratulations. And there are two things that you said, plain language and bringing the public along. And I think that that's what people are hungry for, information that isn't plain language. And people want to be carried along in a way that just resonates. And I think many times those of us who are healthcare providers or doctors or scientists, understanding how to break it down for everyday usage is always a challenge. So one of the things that I will ask you is what is your audience like? Are they, you say everyday people, you started out with students and all of that, are there just non-public health people, non-scientists in your audience as well?
Yeah, well, this has been a journey, just trying to understand my audience, honestly, because in communication, that's the number one question you should ask yourself is, who are you talking to? And I, in the beginning of the newsletter, always thought I was talking to just Joe on the corner, right? Reaching directly into a household. That was until I started doing an annual survey of the readers. The first survey, 77,000 people answered. And it was very clear that I wasn't talking to Joe on the corner. I was talking to trusted messengers. And so these are pastors, these are physicians, these are other public health leaders. These are education boards. They are people at the White House. They're other scientists, literally a huge gamut of people that find themselves in the community that really needed timely, understandable, actionable information so they could push out into their network. And so what I found probably a year or two into this newsletter was that YLU is this node in this massive grassroots information diffusion network. And when that started clicking, it really drove the way I presented content, the way I talked about it, drove what topics were interested in not. And so that framework has really influenced and helped grow the newsletter as well.
Thank you. I think that's very insightful. You know, a grassroots network of people who are themselves messengers trying to get information that they can cascade to their network. So every day, when we talk about the need for digestible, easy, to understand kind of information. Recent statistic about 7,000 queries on Google every day for health-related topics. And you just share that, from violence to a wide spectrum of public health issues. Are there particular issues that you feel like really resonate with the audience, or is it across board, infectious disease, all kinds of issues? What's your experience about what is it that people want to hear about in public health? Or, is it just across board, any and everything people are interested in?
Yeah, I mean, so the newsletter was born out of infectious diseases. So I think I have a biased audience that they just want to hear about infectious diseases. But I have been trying to slowly but surely broaden that scope so people understand that public health and epidemiology is beyond a pandemic and it's beyond even infectious diseases. The biggest challenge, though, is figuring out information voids, right? What is helpful to people today? What type of information are they needing? And that is incredibly challenging on a national perspective after an emergency, because as we all know, public health is local, right? The questions on the ground in Chicago are so different than the questions on the ground in Houston or San Diego or New York City. And so figuring out what those information needs are is a huge challenge, but it's been a fun challenge to try to figure out. And one way I do that is exactly what you mentioned, is Google Trends. So for example, with H5 a couple weeks ago, I looked at Google Trends to figure out what people most were Googling about with H5. And they were questions about their pets. They were questions about what symptoms to get. There were questions about how concerned they should be. Really simple questions that people couldn't find answers to. And so I wrote a newsletter topic hitting those 5 top questions on Google Trends, and my post went viral. Wow. And so what I have found is that, bottom line, about 90% of the content on YLE on my newsletter isn't what I think is interesting as an epidemiologist, but it's driven by questions of what the audience needs and finds interesting as well. In fact, when I write a topic that I'm like, oh my God, this is so interesting about this methodology, it totally kerplunks. Like no one cares what I think is interesting. They're just trying to live healthy lives and make evidence-based decisions. And so changing that perspective is really important. And what I have found is the best sort of content is the information needs of the audience multiplied by the public health impact. Sometimes people aren't going to really care if there's, I don't know, a measles outbreak, but it's really important to us in public health. So we need to both meet people where they're at, as also try to push for the envelope further so we can live healthier lives.
Thank you so much. I think that's just such useful nuggets of wisdom. What are people interested in, and then public health impact and how we marry the two. So that's a lot of opportunities there for us to improve how we connect with our audiences. I mean, Chicago is a city of almost 3 million people. And so we are always on the alert for infectious diseases, but I think just taking time to find out what people are worried about and what kind of information they're looking for can also be an area of growth for us. So thank you for sharing that. So let's talk a little about social media. This is not an area where from CDC to state or local that we have done very well in public health overall. And you've had a lot of success in that space. So are there any learnings, I think, from your perspective for local public health departments like us and in how to utilize and engage people in these spaces around public health issues?
Yeah, I mean, I think the first thing seems really simple, but it's just show up. More than half of people get their health information on social media. And so if we're not there, if public health isn't there, really targeting who we want to reach and how, we're going to lose the narrative. And we've already lost the narrative in a lot of different perspectives. And so I think it's really important to meet the audience where they're at, and depends on what audience you're trying to reach, right? Like if you go on TikTok, you're going to reach a very different of people than if you went on Facebook versus when you're on Instagram. So I think it's one, just taking that leap and just trying. The other thing that I found really successful is, and important, is not just to like put out a post, but to generate a dialogue with that audience. So, and this can be hard to do because comments can be sometimes really mean, but finding those genuine questions and answering them in the comment section and showing that you're listening, right? You can't do every single one, but you can show up and say, that's a really good question we haven't thought about. Here's an answer. Or if we don't know the answer, say, I'll go look for the answer and circle back with you. And so creating that bi-directional relationship with the audience, whether it's on social media or in the physical community, is absolutely essential if we want to, one, better communicate public health, but also to build trust in communities too.
I hear you. And I think that we are also seeing similar trends, like the engagement, what resonates on different platforms differ. The most, the posts that resonate most on Facebook is different from what resonate most on LinkedIn or TikTok or Instagram, which was very interesting for me to see when our media team was reporting that. So just tailoring information to your audiences. And another thing that I hear from you is this bi-directional spaces and opportunities for dialogue. I know a lot of us are afraid of the comments, like people can be really mean, truly, but making sure that there are spaces for people to ask questions and engage, and we're not just putting out information without opportunities for people to ask questions and for us to respond. So that's another important takeaway for us in public health. So
I was just going to say in those comments, you can find out really, you can find out really quick if someone's a troll or if someone's truly there with a really good question and they're just frustrated they can't find that answer or no one's willing to answer them. What we see is that more than like 80% of the confusion, particularly during the pandemic, but all of these other public health challenges, is driven by just concerns and questions they can't find their answers to, and then they turn to misinformation. So I will say, I would even say like 98% of the time I reply on social media, it's actually a very good dialogue. They're like, all of a sudden their defense goes down and like, oh my gosh, someone, let's talk. Like and if you approach it in an empathetic way. There are, I would say, like 2% that are just mean and angry and whatever, and you'll find that real quick which side they're on, and you just ignore that, right? Like, I mean, we have to protect our own mental health too. And so being very thoughtful on how you answer and who you answer to, I think is really important to set the precedent for that audience as well.
Thank you. Let's talk. That's a good tip to keep people engaged. So this is just something that I am curious about. There is increasing conversation around artificial intelligence and how that could potentially be a tool for public health and where people are going for information right now. Is this something that you have dabbled in? That what are your thoughts on this? I've had very interesting conversations about this and how this could be the new thing in public health. What do you think?
Yeah, I have mixed feelings, right? Like I do, because on one hand, we know that AI is here, and it's going to accelerate the speed, reach, complexity, and also innovation of communication, but also with disinformation.
Right.
It's going to create more effective content that plays on human emotion and thus goes viral and then changes human behavior. Um, and it's really going to create these important questions on what is trustworthy, who is trustworthy, and what is the truth, honestly. And I'm a little scared about that part. On the other hand, though, it is a tool. And I truly think that if public health doesn't figure out how to use AI to increase their capacity, increase their productivity, then we're going to still be behind. And so the way that I've been at least looking at it is that it's a tool, right? It can help me I don't know, I use ChatGPT to like outline a speech. And I've had to change it dramatically. I'm like, this isn't the right tone. They don't even get this right. But like, at least it like starts to structure and gets my thoughts in the right place. I mean, I even one time asked ChatGPT to write one of my Wiley newsletters, and it was a disaster. I was like, no, this is just crap. So like, there's a value to us public health people. Like, I'm not worried about it taking our job, but I do think we need to figure out how it can help us, benefit us to increase capacity in such a resource scarce environment of public health. And I think we're going to have a lot of tough questions going forward on what is the truth. And that's where public health really needs to step up as well.
Yeah, thank you. Well, we are so proud of you, and we are so appreciative that epidemiology is now this thing that people can engage with, and you've made it sexy again. And public health is actually interesting, and people are interested in it and curious about it, and that you're making it work, and you're willing to share your learnings with us. In the city of Chicago, we are really committed to meeting people where they are and responding to the needs. And so, and committed to this continuous improvement and learning. What does our audience want? How can we do better in this communication space? So we are watching, we are rooting for you, we are learning from you. Thank you so much for taking time out. And, my last question to you is, any other tips you have for us? Part of our work in big cities like Chicago is just reaching different audiences. We have such diversity in the city. So we're always looking for how we can tailor to our audience. But if you have any tips at all, any other things that you will recommend for those of us who are out here on the front line, hoping to connect with our communities in a better, more responsive way, we are all ears.
Yeah, no, I mean, in Chicago, it has been a leader. I mean, just this most recent measles outbreak, you guys were giving press conferences on a weekly basis. Like, I didn't have any questions on what was going on in Chicago. Like, it was fantastic. And so I think, it comes back to the roots of what is public health, and it's being there for the public, and opening up a dialogue, and making this it's a team sport. And so I think that while we reimagine public health for the 21st century, we still really need to be grounded in those core values. And so I'm cheering you guys on, and I hope to see more from other places around the world.
Thank you. Thank you so much, and wishing you all the best. And we will be watching and learning continuously. And I hope you're doing well also and taking care of yourself. And thank you very much for taking time out of your very busy schedule to speak with us.
Yeah, thank you for having me. This is fun.
Yes. Well, stay well, Chicago. And we will be looking forward to the next episode of Healthy Chicago podcast. Thank you, Dr. Jetelina.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.